for some very, very interesting information and for sharing your thoughts. We have a set of questions, and if we could start with the first session of the afternoon. So a question for Neil. Yes. People talk about a lot of professionals as well as parents find it very time intensive to use behavioral interventions for autism. So ABA principles or the way they are adjusted for autism intervention. And for someone who believes it is too tough or turns children into robots, how would you sort of respond to someone who says, criticizes?
That's a common misunderstanding and misperception of using a behavioral approach. I suppose if someone did this very badly, then that might be, it might look as if that's what you're trying to do, of course. But what's explicit in what we do in terms of behavioral intervention is about the importance of maintenance of skills, but even more importantly, the generalization of skills. So it's all about how carefully the intervention is constructed and run. And there's no reason why it need be perceived as being intensive either, because once you understand the principles and you have a range of targets that you're aiming for, that can be incorporated into everything that you do in the house, in the school, life, in the supermarket, anywhere. So, and in that way, the actual hours that are going towards the intervention are easily accumulated.
Yes. You did mention during your talk about the myths that sort of surround behavioral methods. And
yes.
Could you maybe repeat those 2 or 3 points for people who may have missed your talk?
Yes, certainly, very briefly.
Yes.
I travel around the world fairly extensively, giving talks at conferences and meeting with universities, and a very, very, very common myth when I talk about applied behavior analysis is that applied behavior analysis is one of many therapies or interventions for children with autism. And it is absolutely not that. It's the application of the applied science of behavior analysis, and that is all it is. Behavioral intervention for autism is one of those applications, but the applications themselves are almost limitless. And I gave examples earlier, for example, using applied behavior analytic principles to work in the area of dementia or drug addiction or addressing issues related to global warming and so on, all of which are significant and relevant behavior problems today.
Thank you.
Pleasure.
Neil, there's a question. Oh, sorry, Patrick, Alan, sorry, there's a question for you. Alan, you spoke about orienting yourself to a kid with autism, and how far do you go about doing that, and how do you make sure that the child is not entirely dependent on you or us as someone working with the child?
Obviously, the goal is, the nature of the disorder is that it's a social disorder. So obviously, one of the first things we want is that the child to be engaged with us. Now, I'm not sure how being engaged with others would lead to dependence on each other. We're engaged all the time. It doesn't then lead to dependence unless in all our interactions, if you want to qualify that as dependence, then so be it. But I wouldn't say that. I would say it's a way to see that there's sustained engagement. Mm-hmm. That's how I view it. It's, I'm here. Let's be engaged. Let's transact. Engage in transactions in a variety of different ways.
I'm not sure who's asked this question, whether it's a parent or a professional,
yeah.
And I'm wondering whether they mean sort of if a child gets dependent on prompts and things, sort of how do you fade those out, and how do you sort of make yourself move out and let the child be more independent?
That's a complicated question, but the nature of, I mean, what I was simply trying to get across was that in setting up particular kinds of situations where in which, say, there's a particular problem, we would prefer that someone, wouldn't you prefer that a child come to you to say, look, I can't get this done? Mm-hmm. Or that the child's paying attention to what you're doing incorrectly and they say, hey, by the way, you know, that's not how you do it. Mm-hmm. Or if you're asking the child for assistance, that they are focused on what you're doing. And so I'm not sure if I'm answering the question or if I understand the question correctly, but this is not about over-prompting or prompt dependency. It's a process or a variety of strategies that keeps the child engaged. So I'm not sure how this became conflated with prompt dependency and the like. I'm not sure. I'm not sure if I'm answering the question or not. Right. Does that make sense?
Yeah. Yeah, okay. Dr. Progar, yes. There's a question for you. If there are any ABA principles that you use to motivate your staff?
That's a very good question. One of the things I would say is that I'm a behavior analyst 24/7, 365 days a year, and I think many of us are there at PCDI. So what that means is not only do you have to motivate your students, but you need to keep your staff motivated as well. And I was talking to somebody right after our talk, and some of the rather simple things we do, there's always a lot of praise when we see a new skill that's been acquired. We also teach our staff to recruit reinforcement. It's partly because I'm busy as the executive director, but they know to come into my office and say, somebody just learned how to do this, and if you could come down to the classroom and see it, I'd love for you to come down. And then I can come down, I can watch it. Students get happy, they have a crowd. It's a very warm environment. We also, we get a lot of input from staff. We have, fairly frequent meetings, all staff meetings. They get input. They get to give us input. We give them updates. One of the things we didn't talk about in here, but funding for our program is challenging in New Jersey, especially for adults. We lose about $25,000 a year for each adult, our deficit. And so part of it is we go to our staff and say, we need help. Do you have fundraising ideas or things like that? And out of that, we started a 5K and a 10K run, for example. And a number of our students run in that, and our adult learners run in that as well. So there's a lot of that, and it's also, they get a ton of support. Our staff know they can come into our office at any time. They know that if there's some kind of challenging behavior, somebody's going to be there within 5 or 10 seconds. Yeah. And sometimes it might be where I will guide them as to how I want them to interact or deal with the situation. Other times I might say, looks like you could use a little break. Let me jump in. And then, again, we help them with supervision towards the BCBA. Many of them are in grad school. If they have grad school questions, we help them with that. We're small, it's a very family-like environment. It's very easy to motivate them.
Excellent, thank you. Kerrie, there's a question for you. It's a very broad question. Can you explain more about the CERTS program?
Oh, the CERTS program is by Prasad. There's certainly lots of information on the web, and it looks at those sort of three components of social communication, transactional supports, and having a mental blank, emotional regulation, created by Amy Weatherby and Barry Prasad. It's a program that you can sort of certainly use at school. It's got lots of assessment tools, and it is very sort of centred around the individual, and it's easily you can easily look at those principles within the context of a school, as you can putting in ABA principles within the context of a school. Barry wrote a book, Uniquely Human, which is well worth a read. So have a look at his website. There's some very nice articles that he's written around straight talk in autism, which will give you a bit of a broad understanding of the CERTS model. There's lots of models out there. I think schools, you draw from everything in order to find what particular part works for a particular student at any one time.
Thank you. Dr. Vaidya, There's a question for you about how you manage when a child refuses to eat the medication or the medicines that you are providing.
Foreign medicines.
Yes.
Yeah, isn't it? I think I understood the question properly. How do you manage a child if he's already on some medicine?
No, when they refuse to have what you are giving them, the herbal mixtures and so on. If a child refuses to have
Refuses,
that, how
yeah,
would
it's a big challenge. As I told, one of the limitations of our protocol itself is the palatability of the medicines. But interestingly, see the younger kids, initially, of course, the giving the medicine is a challenge. A little bit of force feeding could be there. That is what I understand in our center. But by the second phase, when they come, they are adapted to it. They are comfortable with it. But initially, if you can give the medicine even with a little bit of force feeding for the first 5 to 7 days, then the child takes it very comfortably, even if it is bitter. That is very interestingly we have noticed. But overall it is a challenge. Those who accept the medicine comfortably, they are comfortable with the taste, the compliance is good and the outcomes is of course good.
Right. And there was another question about if in early literature, if there has been a mention of autism within the Ayurvedic
Sir,
tradition.
asked me
Yes.
directly. It's a very interesting point because Ayurveda hails from maybe 5,000 years ago. Our literatures are very old. So is there a mentioning about autism in any of these literatures? That is a question. So the thing is, Ayurveda as a system has very limited references about direct diseases, like by naming them. But what they have done is they give the key with which the health can be explained or deciphered, the diseases in total can be deciphered. So you will be using these tools in explaining the pathological background, the way of intervention that is to be evolved in each and every situation. So only you have the key and you have to open any new situation with that key. So that is how we do things. That is how we are into the ASD with the very old age tool. So it is not the disease as such, but the philosophy empowers you to address the issue logically.
Right. Okay. If I could come back to Neil, please. There's another question for you. If a person who doesn't have a psychology background, would they be able to get certified within the BSc, the behavioral
Yes,
intervention?
absolutely. The current requirements are that one has to have completed a certain amount of behavior analytic coursework, that you have supervised experience, and that you have an appropriate master's degree.
A master's degree.
And currently, that requirement is that one must have a master's degree in psychology or education, or, of course, behavior analysis. But from 2022, the requirement will simply be that you will have any master's degree, because the coursework requirement is increasing.
Right.
And when you're covering that much coursework, it seems crazy to insist that you also have to have a relevant master's degree.
Right.
And the reason why it's a master's degree in psychology or education, because that could be perceived as rather arbitrary, is simply because the majority of behavior analysis programs around the world are within departments of psychology or education in universities.
Right.
That's the only reason.
Right. Okay. Thank you. Alan, there's another question for you. What would be the prerequisites for tracking social awareness as per the strategy that you proposed in children who are on the spectrum? And how would it be different for a non-verbal vis-a-vis a verbal child?
Yeah, that's a good question. You know, when we start with youngsters, whether they're 10 or 2, whether they've been in receiving early intervention, early intensive behavioral intervention or not, we will often back up to establish this kind of orientation to us using some of the shaping procedures that I talked about earlier. And I learned some of those things at PCDI when I was at PCDI. So we established that at the outset. So youngsters are, again, oriented toward us. The strategies that I talked about today are really embedded within the exercises themselves. So if the exercise is a matching exercise, a simple matching exercise, we have the response package that we talked about. Beyond that, it's sort of, there may be additional components, like to search for the person. To be able, so the prerequisites very often is to make sure, and we have to train this up very specifically, that a child learns how to follow a point, which is very difficult for children on the spectrum. We take weeks very often, if not months, to see that children do that, and we do it in very systematic ways before we say, go get that. We'll say, we'll arrange things in very particular ways. Get me that, and then we stretch the distances.
Yeah.
Or get me that.
Yeah.
When we have to shift our orientation so the child is following our point in the variety of ways we do. So there are lots of things that are required, depending on what you're asking of the child at any given moment. And that's where task analysis is required, and also where we talk about intrinsic program coherence and the analysis of the things that it takes to be able to do things. And that will be dependent on the kind of thing that you're trying to teach at any given moment, and that's where much of our work is, looking at what is involved in this, breaking those tasks down, and then
molding and shaping them. And then shaping them into...
Shaping them or knitting them together.
Yeah.
Yeah.
Okay.
I hope that answers.
Right. Dr. Progar, there's another question for you. There are a lot of cultural differences in our Indian context, and we don't have a lot of government-funded support. So a very sort of personalized model like the PCDI, what would you sort of suggest, considering India's sort of in this very sort of nascent stage with trying to develop programs and centers and trainings?
So to develop a program here, you mean, in India?
Based on a PCDI model, where?
What has seemed to happen in the past, and certainly the models in Turkey and in Poland, what has developed is that it really often begins with one family or maybe two families, and either they have a lot of financial resources, or they know somebody in the government who can help kind of lead that or guide the development of a new program. And that really was what happened in both of those countries, is that you're right, that the government doesn't provide a lot of support, I believe, in either of those countries. In each case, it was a wealthy family who, the way the model works, they sent their proposed executive directors to PCDI, and they trained there for a year before the program even opened up. And so they paid PCDI some money, they paid the salary of their executive directors, but then within a year, they went back to their home countries, they started hiring new staff, and for many years, and this was before I got there, our senior staff would travel to Poland periodically and to Turkey and do evaluations, staff training, troubleshooting, things like that. And then these programs start to bring in money on their own.
Right.
So it's that initial startup is the challenging piece. And so if you can find the money to get that first executive director hired, that leader that you need, everything seems to fall into place.
Right. Okay. Thank you. Kerrie, there's another question for you about how you ensure the safety, the child's safety, especially when there's a kid who's having a meltdown, who's self-injurious and aggressive behaviors.
Absolutely. So at our school, when we have some difficulties or some very sort of high-risk behaviours, what we do is we look at the risk profile of the child, the environment that they're in, and then we have a look at, well, what can we do, or how can we get that child moving again? So, for example, the young girl that I was talking about in my presentation, whose risk profile was that she would pull out her hair to the point where she had pulled out all of her eyebrows, all of her pubic hair, all the hair on her body, and she was very anxious around any stranger that came near, within 100 metres of her, she was very, very anxious and very fearful at that particular point. So there were lots of things that were impeding her ability to participate. So in that regard, we did a lot of work outside, doing things like really low-key bushwalking and going to rock pools that were sort of far away where there were no people, and gradually drawing that back in and making sure that she had staff around her that knew and understand her, that would give her time and space, and they were not frightened by those behaviours as well, because they were there were a lot of physical acting out behaviours there. So that was really important, and we really had to support staff in their emotional response to what was going on for her, as well as supporting her. But it was all possible, and we just needed to really sort of work at that problem and find solutions to that. So we had, we looked at different options for transport, different options for entrance points. We started to manage that environment to allow her to participate and then to be able to get out and do other activities.
Thank you all very much. Could we have a round of applause, please, for all of